Well, awesome. So thanks you for sharing those wonderful stories and how you were able to really change and empower the future of this lady. And so I want to put you in a little bit of a hot seat here, Dr. Bill. And my next question is as a professional chiropractor, have you ever had a chiropractic patient that you weren't able to help?
Oh, of course. Chiropractic can't help every single condition or problem underneath the sun. And there's a couple of main reasons behind that. Not every problem is a chiropractic problem, for one. Second of all, there are some instances where patients present to our office and they're looking for our assistance. But when we get down through the history, the exam, and more importantly, when we get our diagnostics run as far as x-rays potentially, you just see a spine it's just too far gone. It's not only can you not improve it, it might be even dangerous to treat it because it's too brittle or, too osteoporotic or too degenerative or too much arthritis or other things that are going on. Or even potentially in some instances, there's some type of anomaly the person was born with or the way that their body developed, which was abnormal compared to you and I. So, those instances are certainly happen all the time. And one of the first things I always let patients know is that, the goal on day one, when all is said and done, based upon the history of the exam, the diagnostics, and everything we run, is to find out whether or not they're a chiropractic patient or not. If they're not a chiropractic patient, I'll tell them. If they are a chiropractic patient, then I'll tell them that too, obviously, and then we look forward to trying to help them to the best of our ability. The other circumstance that happens, and because it's a two-way street, is patients want to have to get better and help themselves. So if they're just coming into the practice and we're doing all the work, but then they're going home after they spend 30 to say 60 minutes in our practice getting all their therapies, and they're continuing to do things that they should not be doing and not following recommendations, not doing their stretches, not doing their exercises, maybe not following our recommendations as far as water intake or postures and sitting and sleeping, sometimes it doesn't matter how good your treatment is, they're just never going to get better as a result of that.